Hi, I'm Dr. Topher Stephenson. I'm a physical medicine and rehabilitation specialist that focuses on traumatic brain injury. I'd like to talk more about how you make the diagnosis of a traumatic brain injury. First and foremost, we have to remember that this is a clinical diagnosis. There is not a requirement for a loss of consciousness, findings on an MRI or a CAT scan. There are really only 3 questions that need to be asked and answered. The first question is, was there a mechanism of action that could reasonably be expected to cause a traumatic brain injury? Was this something trivial, like putting on a baseball hat? Or was this a motor vehicle collision where there was a significant transfer of energy? Or was this a sporting incident where a soccer player fell and struck their head against the ground? The second question, was there some sort of relationship between the mechanism of action and the onset of symptoms? The third question is there a diagnosis that better explains the constellation of symptoms this patient is experiencing other than brain injury? If the best explanation for that constellation of symptoms is a traumatic brain injury, and the first and the second questions have been answered with a yes, then the most likely diagnosis is traumatic brain injury. Some symptoms take weeks to develop, but once that diagnosis is made, that clinician and the patient can move on and start to figure out how to treat that constellation of symptoms, ideally improving that patient's functional independence and their quality of life.